Hello everyone, I am Dr. Kiran Kumar Reddy, working as a consultant interventional cardiologist at Apollo Spectra Hospitals, Ameerpet, Hyderabad. May 17, 2023 is celebrated as a World Hypertension Day. To signify the importance of hypertension control, all the cardiology societies around the world celebrate this day as the World Hypertension Day to educate the patients regarding the hypertension control, its effects, and how to maintain your blood pressure in the normal range. And this day, the theme of the on the World Hypertension Day is measure your blood pressure accurately, control it, and live longer. I'm going to present a few lines about the hypertension, that is high blood pressure, values, how to measure it, what are the side effects of the high blood pressure, and how to control it. Coming to the statistics, nearly 1.28 billion adults in the age group of 30 to 80 years are having hypertension, and among these the majority of the people having hypertension are living in the low and middle income countries, and nearly 46% of the adults with high blood pressure, they don't know that they have high blood pressure, and less than half of the adults who are having hypertension, that is high blood pressure, are diagnosed and treated, and more than half of the people having high blood pressure are undiagnosed and untreated. Nearly 1 in every 5 adults are having hypertension, which is under control. And high blood pressure is the major cause of premature death worldwide. So the global target of all the cardiology societies around the world is to reduce the prevalence of high blood pressure by 33% from 2010 to 2030. So when you call as high blood pressure, so as we already discussed, the raised blood pressure is the biggest single contributing risk factor to the global health. So the theme to signify the importance of hypertension control, this year's theme on World Hypertension Day is measure your blood pressure accurately, control it, and live longer. So this is the theme brought up to signify the importance of the high blood pressure and how to accurately measure the blood pressure, which leads to the effective treatment of hypertension and giving a healthy longer life. So how will you interpret the blood pressure? Usually normal blood pressure is less than 130 by 80. We will call it a normotension. So if you have blood pressure within the normal range, you measure after 1 year or every 6 months. When your blood pressure is, there are two components in this. The above value is systolic blood pressure. The below value is called as diastolic blood pressure. So when your blood pressure is in the range of 130 to 140 and 85 to 90, you should consider high blood pressure. But in this range, like when the blood pressure is within 130 to 140 systolic and 85 to 89 or 90 diastolic blood pressure, you should better confirm it by checking twice to thrice, and better you can monitor your blood pressure at home and confirm whether your BP is in normal range or in the high range. So high blood pressure is called whenever your BP is more than 150 by 90, more than 140 by 90 should consider as a high blood pressure, and it requires the medical management in the form of non-pharmacological and pharmacological, that is like lifestyle measures and medications. But before starting any medications, it's better to confirm the high blood pressure at least 3 times by measuring the blood pressure within a gap of 5 minutes. When your blood pressure is more than 160/100, it is a definite high blood pressure, and the medications are required. Then a small note about home BP monitoring. So how to monitor your blood pressure in the home? So it should be well supported back while you should measure your blood pressure in the sitting position, and your feet should touch the floor and your back should be well supported. And you can take any validated electronic blood pressure monitor and you attach the cuff to your arm, which should be appropriate size cuff to your arm, and it should be arm bare and resting and mid arm at the heart level. This is mid arm from the elbow to here, it should be at the heart level, and your BP monitor measuring blood pressure device also should be at the heart level. And you should not smoke, you should not take caffeine or food or exercise at least 30 minutes prior to measuring blood pressure, and you should record in a very quiet room and at comfortable temperature, and it should be taken at least 3 to 5 minutes rest after sitting, and there should be no talking during or between the blood pressure measurements. This is the way how you should take the blood pressure at home. So what is the schedule for home blood pressure monitoring for diagnosis or for before each visit? You can measure for 7 days, at least 3 days. You should take morning and evening measurements with all these listed precautions while measuring the blood pressure, and you should measure the BP before your drug intake, like any medications if you are using, and it should be before meals. And take 2 measurements on each occasion with 1 minute between them, and note down the average blood pressure of the 2 recordings. Like in case of long-term follow-up, you are a known hypertensive and you have to monitor regularly and long-term, you can take measurements once or twice per week or per month. So when after measuring your BP, like home measurements of 7 days, at least 3 days with at least 12 recordings. Discuss the first day recording and calculate the average of all other blood pressure recordings. So when your average home blood pressure is more than 135 to 85, it indicates hypertension, and this requires little diagnostic accuracy. Then what are the side effects of high blood pressures? Like how the high blood pressure will manifest in you, what are the symptoms you develop, and what are the adverse events of high blood pressure. These are the symptoms of high blood pressure. So when your blood pressure is extremely high, like more than 180 systolic and more than 120 diastolic, you may develop one of these symptoms in an emergency, like severe headache, fatigue or confusion, visionary problems, or you may feel chest pain or trouble breathing, like difficulty in breathing, irregular heartbeat, or you can hear or feel your heartbeat like thirsting in your chest, neck or ears. You may notice some blood in your urine. What are the adverse events of high blood pressure in the long term? So these are the adverse events when your high blood pressure is uncontrolled and diagnosed. It has effects on lot of systems, other organs in the body, like it damages the blood vessels and lead to various organ damage. Like you may develop stroke, brain stroke, that like may develop weakness of the hands and legs or difficulty in speech in the form of stroke, or you may develop cognitive changes, difficulty in memory or difficult to concentrate, or you can develop hypertensive retinopathy, like difficulty in vision. It can damage the blood vessels in the eyes. You may develop blurred vision or blindness. And another important is you may develop heart attack, acute heart attack, heart failure. Heart may weaken due to high blood pressure. And another important is kidney failure. Kidneys will fail and you develop long-standing kidney disease leading to requirement of dialysis if your BP is uncontrolled. You may develop any other peripheral artery disease called as problem or vessel blockage in the legs or in the hands. You may develop also sexual dysfunction. These are the symptoms and threats of high blood pressure. How can you prevent or how can you reduce the hypertension? By lifestyle changes, like reduce the salt intake, which is the important one in controlling the hypertension. Engage in regular physical activity. Regular physical activity will reduce the blood pressure. Maintain a healthy weight. Eat the fresh fruits and vegetables. Reduce lean meat. Don't smoke. follow the medical advice if you are hypertensive and on medications, maintain strict adherence to the medications, reduce or avoid alcohol intake. Strict adherence to the medication is required in the known hypertensive patients, and home BP monitoring regularly to achieve the hypertensive control. So what are the sodium intake? This is an important thing. You should reduce your sodium in your diet. The recommended is less than 5 grams per day. That is around less than 2000 sodium, 2000 milligrams per day. When it is called as high, more than 5 to 10 grams of salt per day is called high. Extremely is more than 15 grams of salt. So usually 1 gram of salt contains 400 milligrams of sodium. 1 teaspoon of salt contains 2300 milligrams of sodium. So you should not take more than 1 teaspoon of salt per day. Exercise will lead to reductions in your BP around 1.8 in systolic, 1.5 or systolic nearly like around 1.8 to 3.1 a drop in the systolic blood pressure, and 1 to 2 millimeters of mercury drop in the diastolic blood pressure. So a single aerobic exercise of around 30 to 50 minutes is an effective intervention, like effective measure to reduce your BP in the short term in patients who are having already hypertension. So what are the best exercises to lower BP? Some of these are aerobic exercises like aerobic classes like Zumba, walking, brisk walking, jogging, cycling, dancing and swimming. These are some of the exercises which help in reduction of the blood pressure. So finally, know your numbers, know your blood pressure, that is like systolic blood pressure, which is the upper value, and diastolic blood pressure. Normal is 120/80. If it is more than 130 by 85, you should be cautious. If it is more than 140 by 90, it is significant and should take the appropriate measures. So what are the initial lifestyle changes you should consider for reducing your hypertension? Like regular physical activity, focus on your nutrition with salt reduced diet, cut your salt, aim for just 1500 milligrams of sodium or less per day, limit alcohol or stop alcohol completely, lose weight if you are overweight, stop smoking and reduce your stress by meditation and yoga. So this year's hypertension, World Hypertension Day theme is measure your blood pressure accurately. So I had already discussed how to measure your blood pressure at your home. So measure with all those precautions and take a recording if you are a hypertension patient. Control it by lifestyle changes and with medications. You should strictly adhere to your medications and keep on regular follow-up. And by these measures, you can live longer. So this year's theme is measure your blood pressure accurately, control it, and live longer happily. I am Dr. Kiran Kumar Reddy, working as an interventional cardiologist at Apollo Spectra Hospitals, Ameerpet, Hyderabad. Thank you.